asking me to speak today. I think I and the team here today have been on a bit of a journey with crisis care in our trust. So my background in my first 14 years of working in the NHS was in the acute sector, through various layers of operational management to director level, and it never occurred to me that patients might not have somewhere to go, because I was used to day in, day out running A&E units, and actually, no matter what age you are, no matter what your physical presentation, you will be seen and you will be assessed, and you will be pointed in the right direction or receive the care you need. And when I took the leap over into mental health care as a director of operations about 2 years ago, it really surprised me when I sort of started asking the questions as to, so where do people go? Where do people go in crisis? And it was a new lingo, and it was, and I had to learn all the ins and outs of mental health services. But the answer wasn't good enough, because we had very good services, as I see in our trust, and I'm glad to see us featuring in this report. But we still had gaps. So when I met particularly parents and carers of young people, they would say to me, Jonathan, there is nowhere to go past 5 p.m. on a Friday night. You have fantastic CAMS community teams, you have fantastic services in hours, but there is nowhere to go. So we set about 18 months ago in thinking about this very differently, and thinking about the terms of what we wanted to have was a service that no matter what your age, no matter what your condition, we would have an open door facility that would provide assessment, point you in the right direction to services, and treatment 24 hours a day, 7 days a week. That would be separate to an A&E department. And it was very rewarding. The team here, we put together a business case, we secured some funding through our trust board, and we invested in a crisis care centre, and that crisis care centre opened and is now featured in this report. It opened in October. And it really is now the jewel in the crown of our trust. It was recently visited by the CQC. And we will now accept in our trust in Stoke-on-Trent, in this new facility, anyone, 24 hours a day. If you are in crisis, if you need an assessment, you can turn up at our door, you can phone up our number, and our staff will see you, and they will either point you in the right direction or they will invite you in for an assessment. And we are incredibly proud of that service now. So we're getting there, and just to echo something Heather actually said, we shouldn't need that level of crisis service, because actually if we can intervene, in my view, downstream, if we have really robust community services that intervene very early before people get to crisis, then actually we probably wouldn't have needed to make such investments. But the fact is, as we stand at the moment, people will enter crisis, and it's great that we've got the mental health plan and the 5-year plan and the implementation plan and all the investment that's coming with it, because hopefully with all of the investments through to 2023 now, we will be able to invest in those community services, whether it be early intervention, whether it be our employment support services, whether it be our CMHTs, but they should be in complement rather than in contrast to our crisis services. So we've got one piece of the jigsaw there now, and it's almost that we need to move on to make our other services the shining stars that are crisis services. But I think if everyone could get to that stage of having that all-age walk-in 24/7, I think our service users and patients would see a much safer service, and we'd see satisfaction of our staff, as we've talked about, and our service users absolutely skyrocket. Okay. Thank you.